Hello, this is Dr. James Camp at Lee College in Baytown, Texas, and this is my lecture on the histology of the lymphatic system, and specifically the lymphoid organs and tissues. Now, there are a whole collection of lymphoid organs in our body. Perhaps the most famous are the lymph nodes, which are found in collections in different parts of the body, groin and the armpits and the neck and various other places. And these are, I say, perhaps the most famous in that they are named lymph nodes. They're most obviously part of the lymphatic system. Some other tissues that are maybe a little less obviously part of the lymphatic system are the tonsils, the thymus, which is responsible for growing T cells, the spleen, which is sort of like a giant lymph node for processing blood, and the appendix, which is a lymphoid organ attached to the bottom of the large intestine, the start of the large intestine. There's also a group of tissues known as mucosa-associated lymphoid tissues that are found in a lot of lymphoid organs, or rather in a lot of mucous membrane organs. So your respiratory system, your digestive system, even the mucous membranes of your urogenital tract and the female reproductive system. There's one very specific set of malt tissues that gets its own name. It's called Peyer's patches, after a Dr. Peyer, and it is commonly also more technically known as the aggregated lymphoid nodules of the small intestine. All of these tissues play similar roles in that they have something to do with the development and ongoing surveillance of the immune tissues, something to do with the activation of the immune system and its continuing activity in protecting your body. Okay, so we're going to start by talking about a basic pattern, the basic pattern for all of these other tissues, which is the lymph node. To start with, this is the first of a group of organs I like to refer to as the bean-shaped organs. Okay, we've encountered mostly hollow organs to this point in class. The heart and the blood vessels and even the lymphatic vessels have all been hollow. But the lymph node is another type of organ altogether. It's a semi-solid organ that has a sort of a kidney bean shape to it, and as such, it actually serves as a nice prototype for a lot of other organs that we're going to be dealing with in this class. Some of them today in the lymphatic system, some of them in other systems entirely. The first thing to note is that it's got this dimple here, the dimple in the bean, so to speak, and that is known as a hilum. We'll encounter many organs in this class that have a hilum, some of them today, of course, but also the lungs have a hilum, the kidneys, even the ovaries have a hilum. Okay, hilum is, in addition to just being a dimple in a bean, it's where blood vessels enter and exit the organ, and often other things enter or exit as well, such as an efferent lymphatic vessel. Okay, remember from A&P1 that efferent means something is exiting the structure. Efferent exits. The opposite of that is afferent. And there are afferent lymphatic vessels found all over the rest of the lymph node. That bring lymph into the lymph node, and ultimately that lymph travels to this area around the hilum and is drained from in an efferent lymphatic vessel. The other thing that almost all bean-shaped organs have in common is that their area is divided into a cortex and a medulla. Their internal area is divided into a cortex and a medulla. The cortex and the medulla have different structures and almost always have different functions as well. Finally, almost all of these organs have a fibrous capsule layer around the outside. So there's a fibrous capsule to this organ that packages it all together into one little lymph node. So those are all the general features of our bean-shaped organs. Some things that make the lymph node unique: the capsule invaginates every so often. Into structures called trabeculae. Singular is a trabecula. Okay. Inside these cortical areas divided by trabecula, you will find clusters of cells in a sort of circular shape called a lymphoid nodule. Okay, and some of those lymphoid nodules have at the very center a little bit differently colored area known as a germinal center. Okay. Germinal means, germinating, creating, generating life. That is where cells are, lymphocytes are actively dividing in an effort to combat an infection. Okay. So the lymphoid nodule is a collection of lymphocytes and lymphocyte stimulating cells, antigen presenting cells, for example. And it, if it is activated by a particular infection, it will develop a germinal center that starts actively growing new lymphocytes. There are also bits of tissue that extend down into the medulla. These are called cords, medullary cords, and the spaces in between them are called medullary sinuses. Okay, and fluid flows through the sinuses. It flows past the cords. The cords are also accumulations of different immune cells. I believe that the lymphoid nodules are primarily made of B cells and the cords are primarily made of T cells. So they each have their own chance to interact with the lymph as it flows through the lymph node from capsule to cortex to medulla to hilum. Okay, here's a more artistic depiction of a lymph node that shows essentially all the same properties. And this is what an actual lymph node looks like in the microscope. You can see several lymphoid nodules with germinal centers in the area here, which is quite clearly the cortex. Okay, you can see several medullary cords here and here and here. Okay, and medullary sinuses in between them. If we take the lymphocytes off, okay, as is unfortunately sort of necessary for doing a electron micrograph like this, you'll see that there's this network of reticular fibers with lymphocytes stuck to them. The whole structure of a lymphoid nodule is basically a tangled network of reticular fibers that cells can grab onto, attach to, and do their jobs on. Okay, now lymph nodes are great for processing lymph, but what about the rest of the blood? That's why we have the spleen. The spleen, once again, has a lot of these features that we've discussed. It's got a hilum here, okay. It's got a cortex and the medulla, area there. If we zoom in on the cortex of the spleen, we'll see that the splenic artery and vein branch out until they reach areas where the arteries just dead end and the veins don't quite pick up yet. Okay, and in this area in between, we have a zone of what's called red pulp. Okay, and the red pulp is basically red blood cells that have spilled out and are busy being examined by macrophage before they make their way into the venules and venous sinuses and work their way back to the circulatory system. There's also an area here of white pulp, which is a collection of white blood cells, mostly lymphocytes, that are doing immune surveillance on the blood. This is more what it would look like in a microscope. You would see an area of white pulp surrounded by an area of red pulp. And as you might expect, white pulp doesn't actually look white because the white blood cells stain purple wherever they have a nucleus. So the white pulp is actually kind of a purple color, while the red pulp is actually, in fact, a pinkish red. Another area of the body, another organ in the body that has ample lymphatic nodules are the tonsils. You have three sets of tonsils. You have the pharyngeal tonsils on the back of the pharynx. Those are the ones most commonly referred to as adenoids, and that most often end up being removed. Those are the ones that, if you're going to have your tonsils removed, those are the ones that are most likely to be removed because those are the ones that interfere most with breathing. There are also palatine tonsils on the back of the hard palate, or the sides of the soft palate, and the lingual tonsils on the back of the tongue. What tonsils do is they sit around sampling the mucus that is on the back of your nasal passage and the saliva on the rear of your oral cavity, and that makes its way into these open areas known as tonsillar crypts, and there it gets exposed to numerous lymphatic nodules, which are there to do immune surveillance. I believe the tonsils are very important in forming immunity in the first place when you're young. Everything you put into your mouth, everything you sniff into your nasal cavities gets exposed to your tonsils, and that is a great way for forming specific immunity in the first place. And there's also, I believe, some evidence that tonsils continue to help you mount defenses against sore throats, sinus infections, nasal infections, probably even COVID-19 in your later life. So there's an argument that we shouldn't be taking out children's tonsils just because they get inflamed. Now, there are some people for whom that's a necessary surgery because their tonsils are really impacting their ability to breathe, eat, whatever. But the more we learn about these organs, the more we realize that they're not just there. They have important jobs to do, and like any other part of your body, should not be removed unless absolutely necessary. This is a zoom in on one of those tonsillar crypts here, and one lymphatic nodule with its germinal center here in the tonsil. All right. Mucosa-associated lymphoid nodules are found more or less anywhere that you have mucous membranes. So here's a mucous membrane lining the lumen of the intestine, and here, deeper within, is a lymphoid follicle with a germinal center. So this is obviously responding to some kind of infectious agent that was found in this mucus up here and managed to make its way into that lymphoid follicle as it did its immune surveillance job. All lymph organs, except the thymus, have lymphoid follicles, and then certainly the mucosa of the digestive, respiratory, urinary, and reproductive tracts happen. There's one particular set that gets a special name, the aggregated lymphoid nodules in the small intestine, known as Peyer's patches. These are giant collections of lymphoid nodules just at the end of the small intestine before it empties into the large intestine. They seem to play a role in trying to regulate which bacteria take up an active presence in your large intestine and therefore become part of your microbiome, and which bacteria do not. Finally, there's the appendix, which is a collection of lymphoid tissue. Again, here's a lymphoid nodule, here's a lymphoid nodule. This one has a germinal center. And it is also a reserve area, we believe, for intestinal bacteria. Okay, boom, 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 boom. And it is thought that when you have a bad case of diarrhea that might wash out your intestinal bacteria or colon bacteria, or when you have a serious case of antibiotic treatment that would wipe out a lot of those bacteria, that they can repopulate from the backup stores in the appendix. Okay. Finally, if you've ever wondered where T cells come from, there's this organ called the thymus. In a child, the thymus covers a large portion of the area anterior and superior to the heart, so it covers most of the atria of the heart. It's a butterfly-shaped organ. It consists of, once again, trabeculae that divide the tissue into compartments. Each compartment then has a cortex and a darker colored cortex and a lighter colored medulla. T cells leave the immature T cells, leave the bone marrow where they are birthed, enter the thymus and take hold in the cortex, in that darker area. And here they are given testing to make sure that they don't respond to your own body's antigens. Okay, it would be disastrous if you grew up a cell killer T cell, cytotoxic T cell, that went off and killed your own cells. That's how you get situations like type 1 diabetes. So we have a built-in backup mechanism for that. We test all of these with what's called negative selection. If they respond to your own body's antigens, they are deactivated. Only if they don't pass that test do they move on to the medulla, where they are given a chance to respond to an outside antigen, something that would indicate that they are useful for fighting an infection, at which point they mature out of the thymus and start circulating through your body to try to be part of your body's immune defense. This is what an adult thymus looks like. You'll notice that it's much smaller. It no longer covers the atria of the heart. Much smaller area here. And you'll notice that most of it is adipose tissue at this point. Only little clusters of thymic tissue, active thymic tissue, remain. That's because as you get older, your body seems programmed to produce less and less immunity to new things the older you get. So this is one of the reasons why children who grow up in, say, Latin America don't have the problems drinking the water there that Americans do when we go down there as tourists. We come back with a disease they call turista, where we've picked up pathogens from the local water that are making us sick, but they don't make anybody there sick because they've grown up exposed to those antigens, and they have healthy thymuses that can, as children, they have active thymuses that can form immunity to that. As an adult, you don't have that ability to form new immunity nearly to the same amount. In fact, there's a whole field called travel medicine that tries to prepare adults who've never been to a foreign country to cope with the diseases that they'll find that everybody in that country has immunity to, but we don't. An interesting side note to that, the thymus is most active in early childhood and then begins a slow decline into the tween years, as we now call them, the preteen years. but then it has a slight increase in activity around age 13, puberty area. Why do you suppose that is? Our best guess is that your body is programmed to understand that as you go through puberty, you're suddenly going to expose yourself to a different collection of viruses and pathogens. You're going to start kissing people. You're going to start getting sexually active with people, and that exposes you to a different set of pathogens than any your body has encountered prior to that time. So you have a second puberty-related spike in thymic activity, and then somewhere in your 20s or so, the thymus starts degenerating and starting to look like this adult thymus that we see in the picture here. All right, so we've now learned about all these structures in the lymphatic system. The capillaries and vessels and trunks and ducts that carry excess body fluid from your various organs back to your body, back to your circulatory system, your cardiovascular system. And we've also learned now about lymphatic structures, and there are some people divide them into primary, the red bone marrow that produces formed elements, and the thymus that matures and differentiates T cells. And then the secondary are the cells, the tissues that host our immune system once it has been formed and matured and differentiated. The lymph nodes monitor lymph, the spleen monitors blood, the tonsils provide defense against pathogens in air and food, and the lymph nodes and MALT protect against any of your mucosal linings against potentially harmful substances. Okay, and that is the end of our discussion of the lymphatic system. Next up will be a brief discussion of blood typing, now that we understand antibodies and antigens, and then we'll move on to the next big system, the respiratory system. As always, if you feel you learned something from this, leave me a like, leave me a comment in the comment section, and tell your friends you found some cool stuff on my YouTube channel. Thank you for your attention, and have a good day.